So hello and welcome, Gretchen. Thank you so much for spending some time with me.
Yeah, thanks for having me. Like I said, my name is Gretchen. I'm a nurse practitioner at Greater Portland Health. Greater Portland Health is a community health center in Portland. We have some other satellite sites in the area as well. We're a federally qualified health center serving a diverse community. And my role there is, like I said, adult nurse practitioner. My primary role is seeing acute care patients, which means I see anyone for anything, whether it's an upper respiratory infection or wound care, diabetes issues, high blood pressure issues. Also patients that are coming in to see us from the emergency room visit or post-hospital follow-ups.
Well, you certainly are busy. I can see that. So I'm hoping that HealthInfoNet helps you do your work. So as a primary care provider, obviously your needs are multiple and unique, and how you prioritize the clinical information you need to see your patients. So can you share what some of those priorities are?
For sure. So like I said, a lot of the patients that I'm seeing are coming right from the emergency room. Like they may have been seen even the day before. And so HealthInfoNet has made it really easy for me to access their discharge summaries, see what labs they've had, imaging, and that sort of thing. Mm-hmm. Prior to having access to HealthInfoNet, we would have to sign some sort of release, get it faxed to the medical records, and then medical records would fax it back to us. Oftentimes, that whole procedure would take us so long that the patients were already gone, the visits were over, and it would lead to a lot of back and forth trying to get in touch with our patients to clarify things.
That is exactly what we want you to be looking for and needing. So to finish up, if you could share with me sort of like some examples of how the clinical portal data really makes a difference in providing quality patient care for you.
I mean, I've used HN in numerous patients, probably almost on a daily basis. So, again, like someone coming back from the ED and expecting labs that weren't completed when they left there, like urine culture results, for instance, and I can look at that and then treat the patient right in front of me if they weren't treated. Looking to see if they were referred somewhere from the ED, and I can get that access really quickly for them through HIN. Also, being able to follow a patient I've sent to the emergency room or sent to the hospital and seeing the lab on a day-to-day basis has been really helpful.
Wonderful. I am so happy that you can use HealthInfoNet, and it's helpful for the work that you do. And I thank you for the work that you do at Greater Portland Health. It's wonderful work. And I also want to thank you for your time and your input today, Gretchen. Thank you so much.
Thanks, Sharon. Like I said, we're grateful for HealthInfoNet. It's making our much easier.